Hi viewers, I'm Dr. Neelam and I'm a consultant endocrinology and diabetology. Today I'll be briefing you regarding diabetes because it's a major and it's a big public health problem and it is spreading like an epidemic. And diabetes is basically a disorder in which our glucose is not able to get utilized by the body for lack of insulin either, or when the insulin is not able to uh, act the way it should act in the body tissues. And in that case we have usually two major type of diabetes, that is type 1 diabetes and type 2 diabetes. Type 1 diabetes, there is absolute depletion of insulin and the patients are usually lean and they are requiring insulin for their diabetes control for entire life. In type 2 diabetes, patients are usually obese and they have family history of diabetes. Their family diabetes run in their family and they usually have insulin resistance. They can be well controlled initially with diet, lifestyle modification and medicines, and subsequently in late stages or maybe when it is not controlled with medicine, they may require insulin. Now there is another variant of diabetes, that is GDM, that is gestational diabetes mellitus, which is seen in pregnant females. And why it is very important to know that, because nowadays due to screening of diabetes and during pregnancy it is picked, and sugar controls have to be in target range because there is fetal development and metabolic programming is done. So it is important to have a healthy baby for which sugars should be adequately controlled via lifestyle modification, diet. If not, then insulin is also given. Then the other less common type of diabetes are also known, which are syndromic diabetes, which I'm not going to discuss here because the more major ones and the important ones are type 2 and type A. And the cause of concern is that initially it was thought that type 2 diabetes is seen after 40, but it is not the picture. It was always there in kids. Now it is increasing in alarming proportions. The kids are more glued to the screens and gadgets and they are having more type 2 diabetes because they have sedentary lifestyle, their food choices are little, they are more into binging, snacking, and they are not that much physically active. So they are having, even younger kids like in their teens and adolescents, young adults, they are also having a lot of type 2 diabetes. And so all this has to be picked because they develop complications fast than adults. So how do we pick whether you have diabetes or not? So the symptoms are polyphagia, osmotic symptoms typically may not have in all the patients. You have to have a high index of suspicion. If you have family members who are diabetic or obesity or hypothyroid, hypertension, their blood sugar should be checked. Now, how do we diagnose diabetes? The blood tests which are done to detect diabetes are very simple. They are fasting blood sugar and 2 hours PP. We have certain cutoff, and then there is one more blood test which is called HbA1c. So HbA1c tells you 3 monthly average blood glucose, which comes in percentage. If it is above 6.5 and fasting blood glucose is above 126 milligram per dl, then you are labeled as diabetes. So in this part, I'll be speaking about the diagnosis only, which I have just spoken. In the next part, I'll be telling you, once you are diagnosed with diabetes, how can you have control over the diabetes and how you can follow up to have a good glycemic control. So if you want to have online consultation, you can contact me via Lybrate website, or you can see me in my clinic, which is located in Sushant, Gurgaon.